So thank you everyone so much for being here today. We're really lucky to be joined today by by Ella Kopsiak. She is a registered social worker at an oncology registered social worker at the Arthur J. E. Child Comprehensive Cancer Center in Alberta. So with that being said, I'm going to go ahead and hand it over to her. Thanks so much, Casella.
Thank you, Erin. Thank you, everybody, for joining today. So the presentation I'm going to give is on mental and physical pain. So I'm trying to help provide you guys, healthcare workers, loved ones, with insight as how they navigate both the emotional and physical challenges of pancreatic cancer. I'm gonna go there we go. Okay. So who am I? My name is Casella Lingefelt or Ella Kopsik. Ella for short for Casella. Kopsik's my maiden last name. I have a bachelor's degree in law, sociology, and social work. I am a registered social worker in Alberta at the cancer care. We're cancer care now, not AHS anymore, as an oncology social worker. I work with a variety of cancer tumor groups, providing practical supports, supportive counseling, and then also facilitating some groups. When I say that this presentation was done while wearing two hats, so this is what I mean. I have the professional side, as I had mentioned above, and then we get into the personal side. So I am a cancer survivor myself, and then I lost my dad specifically to pancreatic cancer almost 3 years ago. I not only caregived for him, but I was also I was a loved one suffering from mental and physical side effects that I had no idea I was going through that. So I'd like to come into this presentation with a lens of compassion, grace, and a lot of empathy. So our table of contents today, we're going to kind of go over what is pancreatic cancer, emotions, feelings, impacts, uncertainty, grief and loss, the why, how to combat it, distress, supports asking for help, physical and emotional pain, coping skills, rituals, theories, practice, and then self-care, hope, resilience, and some resources. So pancreatic cancer, as I'm sure we're all very well aware, in Canada, the 5-year survival rate is about 10%. So on average, about 10% of people diagnosed will live for at least 5 years. Pancreatic cancer is often not found until it is at an advanced stage and has spread. And while there are very few effective treatments available, aside from surgery, and even then, it's not possible for most advanced stage tumors. So some of the common feelings that caregivers, patients, loved ones can all experience. So the why is this happening? Feeling alone, existential crises, shock, fear, distress, sadness, anger, loneliness, denial, relationship changes, anxiety, depression, lack of control, a lot of fear, specifically fear of the unknown, fear of it spreading, and then grief and loss. So the emotional impact of cancer. So emotional impact of diagnosis and treatment for patients specifically. Um, if someone is able to receive treatment, there's a lot of thoughts of anxiety around treatments, scans, tests, a lot of uncertainty if the treatment has worked, exhaustion from treatment itself, all the appointments you need to attend, um, worry that the cancer will come back or spread, and then trauma around going back to a normal with feelings of hope, positivity, yet a lot of fear. And then for those who can't receive treatment, there can be intense emotions of shock, fear, and grief. It's the constant worry and thoughts about the cancer growing and spreading, and then having to have hard conversations around end of life and kind of what that looks like for you and your family. So emotional impact of diagnosis and treatment for caregivers. So this was based off a paper that I had done. 1 in 4 Canadians are caregivers to family or friends. Um, there's some statistics by age groups from Stats Canada from a couple years ago. So family caregivers are often unaware of the consequences associated with caregiving. the resources available to support them, and then they suffer in silence. Caregiving can create a lot of feelings of burnout, exhaustion, fear, and also helplessness. Family caregivers experience high levels of anxiety, depression, and stress. And then, which I didn't know, family caregivers are at a higher risk for serious and long-term lasting diseases such as impaired immune systems, heart disease, chronic stress, which can also lead to a bit of early death. The role uncertainty plays in creating mental distress. So uncertainty plays a major role in emotional distress for cancer patients. There is uncertainty woven into every stage of the journey, from shock of the initial diagnosis to long days waiting to meet the oncologist, which in Alberta is about 3 months sometimes to see one. It can be a bit of a wait. Um, and then the fear of just not knowing what your treatment plan will look like, all the scans that you have to do, tests, waiting for all of that. So it's a common theme for patients with the distress around the waiting periods. A lot of waiting. It's a lot of unknowns. It's a lot of uncertainty. This ongoing and unpredictability often fuels anxiety, fear, and helplessness, not knowing whether the cancer is shrinking, spreading, or whether the side effects will improve or worsen, which makes it hard to plan for a future. Even small, everyday uncertainties, such as whether loved ones will feel well enough to attend an event or spend time with family, add to the emotional weight that you feel. Over time, the constant uncertainty can erode a person's sense of control and stability. Many patients describe it as living in a state of watchful waiting where life feels on hold. This can heighten feelings of sadness, frustration, and loss of normalcy. For some, uncertainty about recurrence or survival also brings up existential distress, questions about meaning, mortality, and what the future may hold for themselves or their loved ones. Existential distress is something I super, it like overwhelmed me with just so many questions about religion, who I was, what is the future, what is life in general. And this was a big part of trying to figure out with my grief and loss is this piece of existential distress for me. So now we're going to go into a bit of grief and loss. So with grief and loss, just a kind reminder, there is no right way to grieve. It's a constant vicious cycle that you go through all the time of the different emotions. The grieving process requires constructing a new sense of self and identity. Rumination, which is a huge piece in grief and loss, is the inability to stop thinking about it. There's guilt, what ifs, replaying the events, and it's just that main focus on all the negatives going on. Loss can be physical, such as the death of a loved one, but it can also be symbolic. So the little losses that you now face because of the cancer diagnosis, whether for patient or caregiver, relationships change, day-to-day changes, um, sense of identity, feelings, emotion, everything is now different because you're going through this lens of grief and loss when you look at the world around you, essentially. And it affects everything and everyone around you. So when we experience loss, we also lose a part of ourselves. And when we're grieving, it's just when we're trying to readjust to our world after a loss of someone and we try to find meaning in that. So a big piece of grief and loss is anticipatory grief. And um, being able to put this word personally to how I was feeling was a huge almost relief to me to know that it was normal and that this is something really common that almost everyone with a cancer touching your life or a loved one's life, we all kind of face it to some degree. And so it's an emotional response to an impending loss. So feelings of sadness, anger, fear before a loved one, before they've passed, even when they're still here. It's the process of grieving for a person who is living but is not expected to be around much longer. So, this form of grief provides time to prepare for the reality of the loss, allowing for emotional preparation and opportunities to fulfill unfinished wishes or strengthen the relationship. Anticipatory grief can cause changes in behavior and mood. So, mood swings, numbness, shock, anger, guilt, withdrawal, difficulty doing daily activities, concentrating, sleeping. It can come in a wave-like pattern. So it's up and down with your daily life, and it can also coexist with other positive emotions. You can still feel really happy that you're able to do this with someone, but then at the same time feel that overwhelming just distress that you know that they're going to be gone. And so essentially with anticipatory grief, you're holding space for both the positive and negative emotions at this time. Um, I really liked this like bit of a quote somebody had wrote out on TikTok actually about anticipatory grief, and it truly does speak to a lot of things that aren't talked about with healthcare providers or other professionals or friends or families. Like these are the dark parts of anticipatory grief that we face, but we don't know that we're either facing it or going to face it. So it says, it's something no one talks about. It's hard, it's overwhelming, it's lonely, and it's constant. How do you make the most of the time you have left with the person that means the most to you in the world when you know just around the corner your world is about to change forever and you don't know if you'll ever feel okay again? You think about the future differently. You think about who will be there when your loved ones aren't. You sit with your thoughts in a weird purgatory where you can't ever truly feel happy. You look at people with jealousy that have never had to go through the pain you're going through, and you find it so hard to relate to people who have never been through this. Grief by far is the hardest chapter in my life. The why, my favorite question. Um, so after my dad had passed, this was my biggest struggle. The why. Why did this happen? Why him? Why me? Why now? I don't understand. Why did they have to pass away that way? Why did they have to go through this? And, there will never be an answer that feels good enough to us sometimes. And we need to come to peace and let go with the why and why this has happened. And it has been a journey trying to come to terms with trying to understand that I will never know why. It has been a journey trying to let this go. Understanding something as hard as this and trying to let it go, it's not easy. And it's not something that you need to conquer right away. This is something you will get through at your own time and your own pace. So please don't ever let anybody make you feel like you need to sort this out because you don't need to do it in a certain time frame. Um, a lot of counselors will be like the experience of, well, it's past, you can't change it. So like let's kind of wrap it up and move it along. But it's not that easy. Um, I'm almost 3 years out from my dad's passing, and I'm still trying to navigate the why. I'm still on this today, and so just know that it takes time. And yeah, please don't feel like you need to rush this process at all. So there's a couple ways to help you combat the why. The first one is called exploring who I am. The second is radical acceptance. And then my favorite one is continuing the bond. So this activity is just a bit for food for thought. I know you guys will have access to this information later. So I just kind of want to go through the exercise with you. So you're going to draw on a piece of paper, your left hand. It's going to be your life before the loss. You're going to write down what you valued, your thoughts, what was important to you. Was there anything new going on in your life? New things to add. And then, excuse me, you're going to do the right hand, and this is going to be after your loss. So you're going to write down what are your values now, what has changed, who's in your life, what events have occurred, um, and what you don't believe in or maybe do believe in now because of this loss. So the goal is to take a look at the differences before and after and see how it has affected your lives, your values, beliefs, goals. Um, you can explore who you were and who you are now, trying to embrace the new identity and the new lens that the loss has created. There are common themes that you may notice, or maybe there's some differences that you see. How different does your life values and beliefs look now compared to before? Are there any noticeable shifts and changes in your life? How does seeing this written down make you feel? Is there various emotions, thoughts, or feelings that you can pinpoint while doing this exercise or after reflecting on this exercise? And again, I know this feels like really only after a death, but it's after loss, right? And again, loss can mean the little things in your life, the change in your relationship, um, the change in normalcy with air quotes, because there's never really a new normal, and that's just not a fair thing to say after. Um, but it's the little things, right? Somebody doesn't have to pass away to notice, while you're caregiving or while you're the patient, what does my life look like now? I don't, maybe I don't uphold the same values, or there's new values I really hold on to. So, for example, a big thing for me was really cherishing time. It's not that, we ever take time for granted, but we always just expect that there's more time to do things when in reality, it's just not always the case. And so holding on to the present and being in the moment it's a huge value that I uphold now because of the loss. So radical acceptance, it's to surrender the loss and accept that you cannot change it. So it's designed to keep pain from turning into suffering. We can't go back and change it. We can't go back and change what happened, how it happened, and we can't stay stuck on all the whys. This means letting go of the bitterness and releasing unhelpful emotions and accepting that this loss has occurred and trying to find peace with it. Um, So accepting a situation doesn't mean that you approve of what happens. It just means that you're accepting that it did happen. And it also doesn't mean that you've given up. And so no one's to say that you can't be sad or upset or distraught over this loss. It's just trying to let go of the really bad anger and bitterness that some of us can hold when we experience a really traumatic loss or a loss that was super important to us or close to us. And I know that with cancer, sometimes it can be, sudden deaths, unexpected, just really traumatizing overall, watching somebody have to go through that. And that comes with a lot of bitterness and anger that we might not notice that we're holding, but we are holding. And so the goal of radical acceptance is just try to get rid of those really hard, bitter emotions and move into trying to come to peace with it to some degree. How do I continue the bond? So, with continuing the bond, the goal is to shift away from the why into a new space where we remember, honor, and continue to be with them in a different way. So, just some questions for reflections. If anybody in here has had a loved one who has passed from cancer, um, or just food for thought, but what are some things that you currently do that continue the bond between you and your loved one? What are some things you could try that are new to continue the bond? And then why do you do these particular things? What are so important about, the activities you do that create that strong bond for you with the person who is lost? So over time and with support, most people find the ways to gradually integrate a loss into their lives. They may continue to have a relationship with the person who died, even though they are no longer physically present. And so for some, Going to a loved one's favorite restaurant during important days, celebrations, or milestones to continue their bond. Others, it may be a particular movie, activity. Please remember that no one has to understand what you decide to do to continue or carry on the bond between yourself and your loved one. It's what makes sense to you, it's what comforts you, and it what makes you feel like they are there. So my coworkers like to call this mini hellos or saying hello. And so going to Burger King was a huge thing for my dad. It was like his favorite thing to do. He hated cooking. So on those days where I feel like I want to say like a little hello, I'll go there because I feel like he just knows. You know what I mean? So distress. So feeling worried, sad, or overwhelmed during your cancer journey is completely normal. These emotions are called distress. They can affect how you cope with treatment and your daily life. And so this is why distress is now considered the sixth vital sign, which is just as important to check your blood pressure or temperature at a doctor's visit. You might be asked to rate how you're feeling on a simple scale. This helps your care team to understand how to support you, not physically, but emotionally too. You're not alone, and it's okay to ask for help, and we're here to support your whole health. So at our cancer center, anytime somebody comes in for a clinic visit, they're given something called a My Symptom Report, and it's asking to rate, which I'll go into here. It's asking to rate your thoughts, feelings, physical, emotional on a scale of 1 to 10. And so this is a tool that we in the social work department and counseling department use to help rate how somebody is feeling or doing. And so we consider 0 to 4 mild, 4 to 7 is moderate. So there's some concern, maybe starting to introduce some coping skills, mindfulness, and support from a counselor or social worker. And then anybody from 8 to 10 is considered severe and urgent. So there's a lot of concerns about mental health and safety. We would try to get you connected right away back with your family doctor, psychiatry, social work, or psychology for immediate support. So we use this tool to screen patients who come in with distress. It allows us to record the distress patients are experiencing, and then we can use this form to reevaluate while they're under our care. This tool also helps narrow down areas, of concern or areas where the distress comes from. We can then tailor our conversation to best assist with the areas of need identified. So recognizing other signs that extra help may be needed. So you have strong, whether it's negative or positive emotions. So for negative, sadness, anger, fear. Positive, it can be that hyper activity, hyper feelings of super happiness. Sleep changes, again, either sleeping a lot or a little. The appetite change. Finding it difficult to understand your illness or even make treatment decisions. You have trouble concentrating or carrying out routine activities. You feel isolated and alone or worry that you are a burden to others. You find it difficult to speak about your diagnosis with family or friends. And I just want to reiterate that this is very normal. I have a lot of patients who come in and say, I have a lot of friends, I have a lot of family, but I don't want to talk to them about what's going on because I don't want to burden their life or, nobody will understand what I'm going through. And that's a key thing for us because it's not a burden and somebody wants to know what's going on in your life and whether that's a professional or making that small step to bridge with a family member or friend is really important. The frequent thoughts of why me, and then the focus on unfairness of life. You question your purpose of life or life in general. Um, the hyper side, so can't sit still, doing a lot more than you would normally do, actioning their way through grief. So a lot of patients have checklists. I got to get all these things done. Um, that because they make me feel better, more in control of the situation and what's going on. So they will create lists of things that they have to do according to them, to get themselves through what they're going through. So you should seek professional support when you feel that your mood or distress is negatively impacting your life, thoughts, feelings, relationships, and most importantly, your decisions. So if you feel like you're in a state of crisis, you can't function or carry out normal day-to-day activities, you're highly confused, and then the most important piece is you want to harm yourself or others, and that suicidal thought or plan. And with this, I just want to again normalize. It's very normal for people to have passive thoughts of suicide or self-harm. That is super normal. A lot of people have that come and go in waves through their life. It's the active part of the plan, right? So it's no longer just a passing thought. It's something that you're now trying to action on. Okay, so supports and asking for help. So the benefits of support groups, peer connections, and open communication with loved ones. So this can help reduce feelings of isolation, create feelings of community. It's a safe space with individuals going through the journey of cancer and or caregiving. Support groups can validate and normalize the thoughts and feelings you are experiencing. It helps reduce distress, gain coping skills or information gathering, and then it can help create feelings of hope and empowerment. Um, Please know that support groups, peer connections, that isn't something that you have to jump in right away to feel like you have, it's not something you have to do. So this process can take time because it is terrifying just joining the groups in general. And so just know that they're there when you feel ready, when you feel like you would like to take that extra steps. Groups are always there to support you with that. So I actually took this piece out of a PowerPoint that I present at the Cancer Center. So how to ask for help. Um, I feel like this is the best way to put it. Because a lot of people, like when you're caregiving for someone or a patient, well, how can I help? What can I do? Well, I don't know, right? As a patient, I don't know how you can help me. I have a lot going on in my mind, my thoughts, I'm busy. Like I don't have time to figure out how you can help me. And as a caregiver, again, like you have a million different things piled on your plate. I don't have a second to stop and think about how you can help me because I'm busy trying to help somebody else. And so this is a great way to break it down. So maybe under the emotional piece, you just want someone to validate and normalize what you're going through. So I hear you. That sounds hard. Thinking of you, you're on my mind. Informational, maybe, hey, can you find a support group that I can join for caregivers? Maybe that's a task you could put on somebody asking or offering to help. Maybe finding answers or clinical trials, or maybe even finding that cancer specific page for that person. Maybe that's all they need from you. Practical, so driving, grocery meals. I know a lot of patients have kids, so it's that caregiving, childcare piece. So, hey, could you pick my kids up from school today? Could they stay at your house a little bit longer today? Um, do you mind taking me to an appointment? Do you mind taking my loved one to that appointment? And then companionship or comfort. So being there. Uh, you don't always have to talk about cancer. Sometimes you can set a time, right? Maybe at dinner for 30 minutes. That's where we ask questions with family and friends. Maybe that's where we answer things. But after that, no more. Some people like to set some sort of timer for that so that they have that dedicated time and space to do that kind of stuff and then let it go so that they can start enjoy the rest of the time with their loved ones, their friends. And you don't have to sit there feeling uncomfortable, like, oh, they've asked me 200 times and I don't want to answer these questions anymore. So setting that boundary could be really good for you and your friends. So physical pain and emotional pain. So how emotional stress can heighten the experience of physical pain. So stressful feelings, it puts pressure on the body. And then our body's alarm system releases chemicals that go into flight or fight mode. Uh, when we put a lot of stress into our body and our alarm's always going off, we can wear out the stress system. So if stress happens too often, the body gets out of balance and stops calming the body properly. Inflammation and sensitive nerves, muscles tighten, the immune system kind of shuts down. So weaker immune system, inflammation, and then everything just feels a little bit more extra sensitive. And then therefore you experience more pain because your body is on edge. So stress keeps the body in a high alert mode, which makes pain louder and almost harder to turn off. I just want to normalize um, that stress is it is very normal. It's everyday things. It happens to all of us. And so the goal is just to try to help people who are undergoing prolonged stresses to find ways to cope and deal with it to help reset the body back to normal. So why is it important to treat the mental and physical symptoms together? They're deeply connected. Um, they influence one another. So to treat one is essentially you're treating the other. And so managing physical and emotional pain can improve quality of life, relationships, and improve healing. So for example, if your pain has finally subsided, um, are you still at a 9 out of 10 for overall well-being, or was the pain the reason you rated your well-being so negative? So a lot of the times patients are like, oh, like I'm in so much pain all the time. Like I'm my anxiety, my depression is super high. But once we connect back with the doctor and we're able to manage that pain, they're like, yeah, I'm not anxious, I'm not depressed, I'm not stressed anymore. Like now that that's really under control, I feel so much better. So what are coping skills and why are they helpful? So coping skills are tools, strategies, or actions people use to manage stress, difficult emotions, or challenging situations. Healthy coping skills don't take away the problem itself, but they help you handle it in a way that reduces the stress and keeps you moving forward. Practicing coping skills can help reduce the level of distress, improve problem solving, improve overall health and well-being, and then it can help improve relationships as well. So we're going to go into a couple of coping exercises. If you'd like to practice along for the first one, please do. The third one we're also going to do together as a group. So the first one is box breathing. So it is inhaling for 4, holding for 4, breathing out for 4, and then holding for 4 again. I find this is a really nice way, especially when you're in like a high anxiety, high stress, like in appointments, scans, tests. It's a really good way that you can just kind of bring your body back down a little bit. So there's some mindfulness apps. So mindfulness is the state of being self-aware of our body, thoughts, feelings, sensations, and experiences. The goal is to be present in the moment and focus on what we notice while being present. So these are some apps or some shows. So Calm is an app, UCLA Mindful is an app. Headspace from Netflix is a show, but the one to its right is also Headspace app. So these are just different mindfulness activities that you can do on your phone or on your TV if you're feeling um, really stressed out, really high anxiety, almost panicky. These are great, like fidgety things to do with your fingers if you need to do that, and then try to use them to kind of focus on the present. Okay. Okay, so progressive muscle relaxation. There's a lot of different varieties of this. I know we can't really lie down, but I'm going to walk everyone through it. If you guys just want to close your eyes for a couple minutes. So we're going to just be sitting down. We're going to try to relax our entire body. Let's take 5 deep, slow breaths. Lift your toes upward, hold, then let go. Pull your toes downward, hold, and then let go. Let's tense our calf muscles, then let go. Move your knees towards each other, hold, then let go. Squeeze your thigh muscles, hold, then let go. Clench your hands, hold, then let go. Tense your arms, hold, then let go. Contract your stomach muscles. Oh, I skipped my head. Yeah, hold, then let go. Squeeze your buttocks, hold, then let go. Inhale and tighten your chest, hold, then exhale and let go. Raise your shoulders to your ears, hold, then let go. Purse your lips together, hold, then let go. Open your mouth wide, hold, then let go. Close your eyes tightly, hold, then let go. Lift your eyebrows up, hold, then let go. Everyone just wants to take a deep breath, kind of shake their body out, and then you can open your eyes. There's a lot of different versions of this with audio walking you through YouTube videos, all that kind of stuff if this is something you'd like to keep practicing. So practicing pieces and theories. So the art of now. So the art of now has 6 steps that help you step out from your mind and into the present. It's about living in the moment. Having cancer and watching a loved one pass from cancer made me realize how tomorrow is not guaranteed, how precious time is, and that I wanted to start living life without regrets. And so, number 1 is focusing on the present moment, which also forces you to stop overthinking. Being present-minded takes away some of that self-evaluation and getting lost in your mind. Thinking too hard about what you're doing actually makes you do worse. If you're in a situation that makes you anxious, giving a speech, focusing on your anxiety tends to heighten it. When I say be here with me now, I mean don't zone out or get too in your head. Instead, follow my energy, my movements. Focus less on what's going on in your mind and more what's going on in the room. Number 2, people always say, I can't wait to vacation here, but then we always forget that we are currently there. And so, whether it's cookies, music, a movie, a success, savor it. Stop worrying so much about the future and focus on the present and enjoy that moment. 3, engage in mindful breathing. So, mindfulness is so beneficial to us. It helps boost awareness, increases the gap between emotion and action. And then it gives you the opportunity to pause and think. Am I feeling this emotion? How should I respond to these things? Number 4, lose track of time being engrossed in a task. So set a goal with next steps. Be excited and fall into a deep state of concentration and engagement. To live in the moment means to have a total state of flow. So being so engrossed in a task that you forget that you've been doing this for 6 hours and it's like, oh, I didn't even realize I was enjoying that so much. Um, Number five, accept that some things are beyond your control. So if something is bothering you, move toward it rather than away from it. So this piece of acceptance. Um, I wish I weren't so stressed out. The solution is acceptance. So letting the emotions be there, that is being open to the way things are in each moment without trying to manipulate or change the experience, without judging it, clinging to it, or pushing it away. The present moment can only be as it is. So trying to change it might only frustrate and exhaust you. Acceptance relieves you of this needless extra suffering. And then number six, try to notice new things in everyday situation. Legacy work. So this is something that we can all kind of do. It doesn't have to be somebody who's suffering from cancer. Really, this applies to everyday life. And so, legacy, something is I had only ever heard of after my dad had passed away. I had spent weeks combing through old boxes of cards and papers just to capture his signature, his writing, and his words. Um, and this is a really hard topic for some people when I try to bring it up in conversation, because it's essentially creating things that have lasting memories or meaning. It involves patients creating a lasting, tangible or intangible gift for their loved ones to honor their life, express their identity, and to share their wisdom and values. These activities provide an opportunity for life review, reduce feelings of isolation, strengthen family bonds, and then contribute to a sense of meaning and purpose for both the patient and their family, ultimately aiding in the grieving process. And so this can be writing memoirs, writing letters for, birthdays, holidays that are going to come up that as a patient you might miss, creating photo albums, voice recordings, painting, and this is a multidisciplinary team thing. So, rehab, rec therapy, spiritual health, psychology, and social work all participate together to help create legacy work for patients and their families. So, rituals, this is, I find the best way to cope is by doing rituals, especially in situations that trigger my trauma or loss. So a grounding ritual when you're super anxious, 5, 4, 3, 2, 1. So name 5 things you see, 4 things you feel, 3 things you hear, 2 things you smell, 1 thing you taste. And so the goal is to um, say those out loud as to get your mind to focus on those other things versus the anxiety that you're feeling. Emotional ritual, so journaling. Some people like to write down how they're feeling, and then sometimes they rip it up, they burn it, they throw it away to help release that feeling. And then meaning making, so affirmations or mantras when you're in situations that are really hard. So repeating, I'm safe, this feeling's going to pass. And then if prayer or meditation help you, definitely engaging in that. So some positives to end. Please remember to be easy on yourself. Patient, caregiver, loved one, healthcare professional. Give yourself some grace. Give yourself space. Do stuff that makes you happy. You have, permission to be upset, angry, sad, but also happy. Please be kind to yourself, and please don't try to burden yourself with I have to, I should, I must, or I ought, because you don't. Self-care. It's important to take care of yourself while you're going through this incredibly difficult journey. So taking care of yourself can be small things or it can be big things. If self-care is difficult for you to practice, try setting goals around doing a self-care activity at least once a week and then building up from there. The more we practice, the more it will become second nature. So I know eating is a huge thing for some people. So if you want to have a treat every so often that makes you feel happy, do it because that's important. How you feel is very important. Exercise, being in nature, being with friends, journaling, joining groups, whatever you need to do to feel okay. That's really all that matters at the end of the day. Hope and resilience. So these both provide emotional stability in a very unpredictable journey. Patients can hope for the best while preparing for challenges. Sorry, that's my cat. They help patients make meaning of their experience, whether through relationships, spirituality, or personal growth. They buffer against depression and despair, improving quality of life, even when a cure isn't possible. Families and caregivers also draw strength from a patient's hope and resilience, creating a shared sense of courage. For pancreatic cancer patients, hope and resilience don't erase the pain of the diagnosis and treatment, but they give patients the strength to keep going, the courage to face uncertainty, and the possibility of finding meaning and moments of joy along the way. What resilience means, it's not about staying positive all the time. Resilience is the ability to adapt, recover, and find strength even in suffering. Resilience grows with practice, and many patients discover inner strength they didn't know they had, and this helps them face treatments, procedures, and uncertainty with courage. So, how hope and resilience can show up, finding ways to live fully despite illness, accepting help from others, and building strong support networks, using coping skills to manage stress and pain, and then trying to reframe the situation. So, something I find super important is always celebrating the small victories. Excuse me, my cat's going to claw the door out. I'm just going to let her out. Yeah, so it's not always the big victories that you have to focus on. Sometimes it's just those small things that are really important, and that's what needs to be focused on. And then just some reflection. So I can't always choose what happens to me, but I can choose how I respond. Every small act of coping, every ritual, and every moment of strength, of hope strengthens my resilience. Coping skills aren't about avoiding pain, they're about giving myself tools to face it with strength. A ritual can turn fear into grounding, a moment of meaning instead of panic. Resilience is not about being strong all the time, but allowing myself to bend and heal without breaking. Resilience is something I grow, not something I must already have. Just food for thought. So resources for patients, Wellspring is a really big one. Pancreatic Cancer Canada, support groups, one-on-one counseling if it's through your family doctor, hospital, or privately. Um, Here we have Living with Advanced Illness Center, which is for stage 4 end of life patients, families, kids, caregivers, everyone. Craig's Cause, which is that financial piece online that Erin had mentioned. In Alberta, we actually have several financial programs to help cancer patients. So, Patient Financial Assistance Program, Hang in the 30s, and then an online support group for young cancer patients and their caregivers is YAC as well. So on the caregivers piece, I put down some links to some of those supports. Caregivers Alberta, Wellspring. Uh, we have a grief and loss center specifically here in Alberta as well that helps guide you through that process. Virtual hospice for grief and loss modules if you wanted to do some e-learning on your own. Start the Talk from CAPO is just on everything cancer related, really. And then the Canadian Cancer Society also has some talks on how to talk to kids about cancer and then even for patients, caregivers, loved ones. References, of course. Yeah. Thank you guys so much.